Namaste everyone, this is Dr. Meenakshi, MDIU, Kaumara Vritya. So as you all know, I will be explaining one health tips or health topics about the children or about the adults, everything, right? So today I am with the common, especially nowadays common female health issues, like especially in fertility health issues. This you may be heard, especially during the conception, that is conceiving age, fertility age, reproductive age 20 to 30. All females will be complaining irregular of menstruation or the difficulty in conceiving a baby. These all are common normal complaints which we are getting in the especially in the gynec departments, right? So what it is known as, the doctors will advise or diagnose it as a PCOD or PCOS. You may be heard, right? So in this, what it will be, there will be difficulty in conceiving or the problem in the menstrual cycles. So today I took a topic as PCOD problem, basic knowledge about the PCOD. So let's start the topic, that is, what is this PCOD, especially polycystic ovarian disease. It is also known as PCOS, that is polycystic ovarian syndrome, right? What is this PCOD or PCOS? A hormonal disorder causing enlarged ovaries with small cyst on the outer edges of the ovary. This condition, when the doctors advise scanning and when you find these problems or these impressions in the scanning, then the condition is known as PCOD. How popular it is, like how the frequency of spreading this PCOD problem. More than 1 million cases per year in India, females are suffering from this PCOD. So what may be the cause for this PCOD, right? Your next question will be, what may be cause for this PCOD or PCOS? The exact cause of PCOS or PCOD is unknown factor. There is evidence that genetic play a role in this. The exact cause is though unknown, but the frequency of survey said that genetic problem may be the one of the role cause for the PCOD, or in one stage. Another stage, several other factors also play a role in causing this PCOD, has higher level of male hormones, that is androgens, and this high androgen level prevents the ovaries from the releasing the eggs, which caused irregular menstruation. Due to this male hormones, high level of male hormones, it will block the ovaries to release the egg. So the PCOD complaints will start. The other reason, what is the cause for this increasing level of male hormones? Again it depends on dietary, or again it depends on environment, other causes which we will see in the next slides. So this is the main basic causes too, that is genetic role or the level of male hormones will be increased. So this PCOD initial state takes the place to start. Next point is, what is the signs and symptoms for this PCOD? Maybe hair loss means especially like baldness in the male, how we can feel like that. Hair loss will start. Hirsutism, what is this hirsutism? Hirsutism means extra hair growth, like however in PCOD we will be having male hormone increased level, so like maybe in the place of mustaches or maybe the near the area of ears, extra hair growth will be present. Pelvic pain, this is the one of the symptom of PCOD. Or infertility, as I said, it will be difficult in conceiving a baby, or gaining overweight drastically, and irregular periods. Overweight drastically increasing is also how you can't back it, you can't reduce, only the weight will be gaining. And irregular menstrual cycles, and testosterone levels increasing, as there will be male hormone changes, imbalance, and TSH level will also increase, or imbalance of the TSH level. And acne over the face with scars, These all are the signs and symptoms which you can see in the PCOD. By in these all signs and symptoms, at least you have 3 to 4 positive signs and symptoms, then immediately go and consult your gynecologist. Now you may ask a question that if we have 3 to 4 signs and symptoms in positive way, then it is the way of diagnosing a PCOD, right? No, actually your gynecologist will have all these questions, complaints, chief complaints history they will take. Then on the basis of 3 categories they will diagnose a PCOD. If out of these 3 points, if 2 points are present in you, then you are diagnosed as a PCOD disease. What are those 3 points? That is oligo or anovulation, that is delayed menstrual cycle or irregular menstrual cycle, problems between the menstrual cycles, hyperandrogenesis, that is hyperandrogenism is a, as I said, there will be high level of male hormones. And next thing is polycystic ovaries. In scan you will get a polycystic ovaries, that is your ovary will be enlarged with the small cyst around the edges of the ovary. If in these 3 conditions, like irregular periods or delayed menstrual cycle, or the high level of male hormones, and the third point is polycystic ovaries. If in these 3 points, if 2 is present, then you will be considered as a PCOD patient. So in this scan which I am showing the slide, you can see what is the normal status of ovaries and how the ovaries will be in PCOD or PCOS patients. This is the difference between the normal fertility reproductive system of a female and who is suffering from the PCOD. Then the next point will come is whether this PCOD is curable or incurable, right? Whether it will be cured or it will be lifelong, right? Many have in their mind that if they have PCOD, they can't treat it. The PCOD is untreated. It will be lifelong, right? But according to Ayurveda, we can treat PCOD. But as we know, this PCOD is in of 2 forms, right? PCOD and PCOS. As I said, PCOD is the condition in which the ovaries produce many immature or partially matured eggs. This happens due to poor lifestyle or obesity or stress or hormonal imbalance. This can be treated if we change the lifestyle, and if we go for if it is in severe form, if we go for medication, like especially in Ayurveda like Shodhana karmas, this PCOD is treatable and the mother can have a baby also after treating this PCOD. But in condition of PCOS, what is this PCOS? PCOS is polycystic ovarian syndrome. It is a metabolic disorder and more severe form of PCOD. It can lead to anovulation where ovaries stop releasing the eggs. This PCOS is difficult to cure. In this PCOS also we can treat by changing lifestyles or in the form of Shodhana karmas, medicines, everything, but it is difficult, bit higher form of the PCOD. But if you have a PCOD, then obviously it will be cured. Consult any nearest Ayurvedic gynecologist. She will treat you the PCOD and you can have a normal routine life. So rather, as I said, Shodhana karma, I can't explain here what is Shodhana karma, what all you can take in PCOD, because it depends on your prakriti, right? According to our Ayurveda, it depends, every disease and every treatment depends on your particular prakriti. So consult any Ayurvedic gynecologist and you can have a treatment. But here I can give only some home remedies which you can follow to treat PCOD or PCOS. As you can change your normal routine basis, like hormonal and metabolism changes maybe, or personal or reproductive health changes, your mood, sleep, like stressful life you can change, and nutrition and exercise supplementaries, like nutrition supplementaries you can take, or exercise, or skin and cosmetic care. If you care all these, like hormones and metabolism, personal and reproductive health, your stressful life, supplementaries like nutritions, and daily routine exercises, and skin and cosmetics. If you care all this, you can change your PCOD day by day. Like healing, what all steps you can take: eat healthy, exercise and lose weight, blood sugar control, because in PCOD there will be increase of blood sugar, and taking vitamins, supplementaries, eliminating toxics, anti-inflammatory treatments. If you follow these all, then you can treat a PCOD day by day in initial stages. If you have crossed the initial stage, then by changing these all points, you need some medicines, like specially Ayurvedic medicines. If you follow, it will be good enough. And this treatment of the PCOD will be in 2 levels. That is, initial step only changing the lifestyle, but in second step there will be alternative medicines with pharmaceutical medicines. If you follow, then obviously this PCOD will be treated in 3 to 6 months. And I can explain some home remedies you can follow to change your lifestyle in initial stage. As I said, there will be 2 levels to treat the PCOD. In initial form, you can follow like home remedies: apple vinegar, you can use fenugreek seeds, cinnamon, flax seeds, and spearmint tea. These all if you can add in your routine life, but avoid mango, banana and lychee having in more quantity, because these have the more number of calories, and it can increase the sugar level again, right? So, and have fresh fruits instead of juice form. Instead of having in a juice form, have raw or fresh fruits, and can have whole grains, vitamin B12 supplementaries like curd, paneer, sprouts, and idli, that too fermented idli you can have, and increase intake of fats, vitamins and minerals. Now till now we saw what all we can have, right? As we know, everything have indications and contraindications, right, which we can have till we know we saw, right? But now we will see which all we should avoid, the things we should avoid. Avoid means you can't, by having anything you can't stop totally for lifelong period, right? But you can minimize them, avoid or minimize the intake of these points which I am saying now. That is, high GI foods, like they will increase the blood sugar, which fruits or vegetables or things which increase the blood sugar, minimize them. Minimize the taking of caffeine content, because it will affect the fertility rate in your body, and minimize the intake of hydrogenated oils, like which will increase bad cholesterol. So, minimize the taking of that oils. Alcohol, you should avoid alcohol, because it worsens the metabolism of the sugar level in the body, and minimize the taking of dairy products, because it will cause the allergic reactions and it will cause digestion problems, and minimize the intake of white sugar, because again it increases the sugar level in our body, and minimize the intake of white flour and white rice, because it suppresses the immune system in our body. So minimize the white flour and white rice. Minimize the intake of gluten grains, because they will cause again digestion problem, and minimize the intake of red meat, because this red meat will affect the hormonal system in our body. So these all points we should avoid or minimize the intake of these points. So I tried to explain in a basic way about what is this PCOD, how it is caused, what all the symptoms you will get in the PCOD, and how you can treat it. in initial stage, as I explained, you can change your lifestyle and you can treat it. In further stages, you can visit a Ayurvedic gynecologist and you can have a treatment, but it is not untreatable. You can treat this PCOD or PCOS, but again depends on your prakriti and the duration of your disease. So if you feel the video is helpful, then give a like and share with your friends. Thank you.